that experience because we had midday caucus sessions before our voting meetings of the Assembly, as Assemblyman Horn remembers. And so one thing I learned, which I conveyed to Jerry just a moment ago, is that going shh works remarkably well. And the other thing I learned is that it's great to feed people because then they're less likely to talk back while they're eating. So I'm delighted to be your luncheon speaker today. I know that was not the original plan, but better to be a luncheon speaker than the speaker that who was standing between you and lunch. It's great to see Commissioner Tom Considine here, my fellow alum of the Christie administration, and to be able to participate in a forum with Poonam Alek, our fellow alum from the Christie administration. It is really great, the active leadership role that Poonam is taking in the Common Sense Institute, and the excellent work she has been doing on the health policy with this organization. I wanted to be here today because I believe that the Common Sense Institute really is playing an important role in New Jersey public policy. It's become an important policy voice and an important convener of serious policy discussions in New Jersey. And I know it's a voice and a convener that gets attention. In fact, when I was Chief of Staff, I used to periodically meet in this room with a coalition of thought leaders convened by Jerry Cantrell to talk about some of the important economic and other policy issues facing New Jersey. So I tried to remain supportive and active upon my return to the private sector. So this morning, from Poonam and Joel and Ward, you heard some serious talks about important issues and some of the really challenging policy issues confronting the state and the nation right now in healthcare and healthcare policy. I'm going to somewhat, for me, uncharacteristically take a step back. Usually I jump right into the weeds and the details of policy. What I've volunteered to do when Jerry contacted me, Ben Poonam contacted me about this program, just to offer a few observations, data-based observations on the value of medical innovation to patients, society, and the economy. And my premise is some of the challenges that we're all, all too familiar with, in terms of the challenges of demographics, aging population, the challenges of the incidence of disease, and some of the challenges of the seemingly unsustainable cost trends. Make it seem like there's a sort of a unsolvable Rubik's Cube in healthcare policy of the three dimensions of coverage, quality, and cost. And my premise is that you think about how to solve that that three-dimensional Rubik's Cube of coverage, quality, and cost, and some of the seemingly intractable trends, that innovation is a big part of the solution, right? So the things that we can only imagine right now are the things that will be delivered in the generation to come and will help us solve that Rubik's Cube and help us address some of those seemingly unsustainable trends. Just an example, the current forecasts of the cost of treatment alone for Alzheimer's disease a generation from now in the United States is approximately $1 trillion a year to the healthcare system for treatment alone for one condition. there needs to be a solution, right? That there needs to be a solution based on innovation that with new and better diagnostics and treatments to prevent, delay, and ultimately treat Alzheimer's disease. A far better solution for patients and society and the economy than figuring out how we're going to afford the $1 trillion and beyond on an annual basis. So what I'm going to do for the next few minutes is just quickly, I've got a bunch of slides, but I'm going to show them to you quickly because I just want to share some data and share some information. Each piece of information is sourced in almost all cases through a peer-reviewed journal. And I'm going to let you draw your own for the most part. I'll be unable to avoid the temptation to offer a few editorial observations. But for the most part, I'll let you draw your own conclusions. Information I'm going to share is a portion, sort of like best hits of a sort of a 100 top 100 facts in chart forms in a chart pack that we at Celgene have developed on the value of medical innovation. And if you're interested in seeing what I'm showing, but also seeing the full chart pack, if you send me an email, I will send you an electronic copy of the full document. My email address is rbagger, R-B-A-G-G-E-R, at Celgene, CELGENE.com. Okay, so let's take a look. So I'm going to speak a little bit about the past 50 years or so, what's happening right now, and the impact that has for patients and society. So these charts are fairly small, so I hope they are visible from where you are. Maybe I'll stand here to see if I can see them. But this just simply shows what has happened in the last century in the United States, with the 62% increase in life expectancy at the same time that there has been a 96% decrease in the death rate. And of course, there are multiple contributors to the increase in life expectancy, public health considerations being an important contributor, and advances in medical treatment, medical science, and medical technology, a very important driver. In fact, according to a study by Frank Lichtenberg, in the last 4 decades of the 20th century, 45% of the increase in life expectancy in the United States was attributable to new medical treatments, and that rate is accelerating such that in the last decade, with 3/4 of the increase in life expectancy in the United States attributable to new treatments. So I was born in 1960. So if you add those together, that's about half of the increase in life expectancy in my lifetime attributable to new medical treatments. There's several charts here where I put 2 pieces of information on the same chart, and to the extent they bear something to do with one another, I'm not asserting causation. I'm maybe positing correlation. But Tom?
Rich, I'm sorry to interrupt. At the end of life expectancy, is the end of life, the last 18 months of life, a sicker 18 months now with a longer life expectancy than the last 18 months of life were when the life expectancy was 20 years or 15 years shorter? Has anyone looked at that? And therefore more costly?
I don't, there may be people in the audience who know the answer. I don't know the answer for the last 18 months. I do know that in terms of the contribution of improved medical care and medical innovation to the economy, one of the key drivers is the increase in healthy life expectancy. Right, that portion of life where people are in good health and working and being productive. And then, of course, you want your healthy life expectancy, even as a society, to be the greatest proportion possible of total life expectancy. Dr. Legg may have it.
Yeah, Tom, for the last, in the last 6 months of a patient's life, 25 to 30% of healthcare dollars get spent. Since the 70s to today, that proportion of healthcare dollars that get spent in the last 6 months has not changed.
Oh, okay, good.
So it stayed the same. So we've done a great, healthy is great, healthy, productive lives, but the last 6 months is still a huge opportunity in terms of quality.
Great. Sorry.
No, thank you. This just shows the declining mortality rate from all causes on the same chart as the increase in R&D spending in biomedical innovation. This reflects the declining death rate from particular conditions. Again, coincidentally in my lifetime, since 1960. Varies significantly. If you look at heart disease, I mean, I remember, some of my generation growing up, everybody knew somebody in their class in school whose typically father had died of a heart attack, in their 40s or far too young. Even the death rate here in heart disease now being about a third what it was 50 years ago. That trend has accelerated such that a significant part of that decrease in cardiovascular mortality has occurred in the last 10 or 15 years through better hypertension control, through statins, through surgical and medical technology advances, a major improvement. Similarly, infectious diseases, great progress during that period of time. Progress in cancers, we'll see shortly, is starting now, especially in the last 15 years, to accelerate. Some of the significant reductions in the stroke. So medical innovation, in some ways, it corresponds with technology innovation, and the sequencing of the human genome is as good an example as anyway. So that the United States taxpayers paid for the sequencing of the human genome through the National Institutes of Health. And I believe the cost of the sequencing of the human genome is $3.8 billion. I don't know if I have it on a chart in this presentation or not, but the total economic activity that resulted from that investment of $3.8 billion of taxpayers' money in the sequence of the human genome is in the multiple hundreds of billions of dollars for the U.S. economy, such that 2 or 3 years ago, in 1 year, the tax revenue, 1 year's tax revenue to the federal government from the economic activity based upon the sequencing of the human genome paid back the government's investment from the NIH in sequencing the human genome in just 1 year, in terms of the financial investment in the sequencing of the human genome. Now, in reference to Moore's Law, right, the declining cost over time of chip technology, well, the same is true of sequencing of the human genome, which is now down to sequence the genome to less than $10,000. Will be shortly to the period of time, where sequencing an individual's genome becomes a standard medical test at very affordable rate. It will be less than $1,000 at some point. That matters enormously in cancer treatment development. This shows the accelerating advancement in genomic-based therapies, especially important for cancer. So this is having an impact. So I just show information about a couple of particular cancers. So our company, Celgene, is currently entirely focused on cancer. The company has a very successful pipeline and will be entering other therapeutic areas shortly. but now we're in hematology and oncology. And in hematology, an area where our company is very active is in multiple myeloma, a deadly blood cancer, where survivorship in the last decade has increased substantially, and life expectancy at diagnosis has tripled or quadrupled during that period of time as a result of medical advances. Demonstrates the same proposition. The same is true in other hematological conditions. And we're starting to see across blood cancers. Non-Hodgkin's lymphoma had the sort of key statistic in cancer is the mortality incidence ratio. Therefore, for some cancers have an increasing incidence, other cancers have a fairly flat incidence. In some cases, the increasing incidence has sort of environmental or external causes. Sometimes the increasing incidence is just simply a result of increased life expectancy. At the age of diagnosis, as more people live to a greater age, the incidence increases. The percentage of mortality incidence is a key statistic, and you can see that non-Hodgkin's lymphoma is half of what it was in sort of the dawn of the modern cancer era. So advances in medical technology and medical innovation are the driver of economic growth. This is one of my favorite charts. And here again, this is one where I am not alleging causation. Let you draw your own conclusions. This is charting the increase in life expectancy since 1929, with growth in the real GDP per capita in the United States. As life expectancy has increased, GDP has grown along with it over the course of close to a century. In fact, according to Murphy and Topol, small print there for the source, over the past 50 years, medical innovation and the increase in life expectancy that it leads to is the source of what we're having growth in the United States. Another study has demonstrated that each 1% reduction in cancer-related deaths in the U.S. Creates $500 billion of societal value. This is just put in here to demonstrate the sort of macroeconomic impact of the biopharmaceutical industry. I think, in fact, well known to everyone in New Jersey, the biopharma sector, where the U.S. is the world leader, generating over 2/3 of the intellectual property in biopharmaceutical innovation in the United States, a sort of crown jewel of the U.S. economy, for total direct and indirect employment, 4 million U.S. jobs. There's a paradox of medical innovation, and the paradox is that we're at an extraordinary time in science. Now, I work in a very science-driven company. The things that are happening that follow from the fuller understanding of the human genome, now the emerging understanding of the impact of proteins, sort of the sub-DNA level on disease, is opening up an extraordinary sort of set of doors and windows for therapeutic advances that are sort of just more than on the horizon. In fact, there was a Time magazine cover story on cancer about a month ago. Very interesting. It was a very interesting piece, and it made the point, that there was a difference between when Kennedy said America would, put a man on the moon in the 1960s, when he was able to make that promise in 1961, I guess. He could make that promise because it was known then how to do it.
What was left was